For my PhD, I investigated the behavioral and neuropathological consequences of traumatic brain injury, also known as TBI. I showed that CHIMERA, a rodent model of head injury, replicates many features of human TBI. In the future, I hope that CHIMERA can be used to validate promising drug targets to help in the treatment of TBI.
I investigated the role of high-density lipoproteins, particles in the blood made of fats and proteins, in protecting brain blood vessels in Alzheimer's disease. My work shows that raising the levels of functional high-density lipoproteins through drug or lifestyle changes may protect against brain blood vessel changes and prevent Alzheimer's disease.
My doctoral studies focused on advanced prostate cancer. My work improves our understanding of the development of treatment resistance and provides a potential therapeutic target for this lethal disease.
Hi, I'm Andrea. For my PhD dissertation, I examined the epidemiology of common mental disorders in workers with a lost time, work-related musculoskeletal injury. I found that having a common mental disorder, in addition to a musculoskeletal injury, was associated with lower likelihood of achieving sustained return to work. These findings have implications for work disability management policy as well as practice.
I characterized the risk factors, dynamics, and consequences of psychosis experienced by adults living in precarious housing in Vancouver over a period of 5 years. These longitudinal studies contribute to our understanding of how psychotic symptoms evolve over time and illustrate opportunities for intervention.
Hi everyone, my name is Connie Leung, and for my doctoral dissertation, I examined candidate obesity and diabetes genes. I found that reducing the amount of one gene, called PTK1, affects lipid metabolism and the heart. Further, these metabolic effects of PTK1, as well as environmental factors, are important to consider when using this gene as a potential therapeutic.
I examined multiple aspects of HPV vaccination in women living with HIV. I found that while the vaccine has good efficacy, the post-vaccination burden of oncogenic HPV suggests that cervical screening remains important. These findings will inform the World Health Organization's global strategy for eliminating cervical cancer.
Dr. Nackiewicz studied how immune cells, called macrophages, contribute to inflammation in insulin-producing islets in type 2 diabetes. She showed that macrophages could either induce or resolve islet inflammation. This work could aid in the design of the therapies that may improve function of islet cells in diabetes.
Hi, my name is Matthew Sachell and I'm a proud doctoral graduate in neuroscience. For my thesis, I used fMRI and PET neuroimaging techniques to show that exercise can increase dopamine release in people with Parkinson's disease. This shows that exercise is specifically beneficial for people with Parkinson's and supports the use of exercise as an adjunct therapy.
Hi, I'm Greg. I studied lung cancer genetics and I discovered how a new class of genes called non-coding RNAs are altered in order to drive this deadly disease and if they may be promising clinical targets. But the most important thing I learned during my PhD was learning how to love.
I'm Catherine Wang. During my PhD, I characterized the structure of the CHIMERA protein, which is mutated in people with heart rhythm disorders. My findings demonstrate that each mutation causes disease through distinct mechanisms, and this work will help to improve our understanding of heart rhythm disorders and their causes.
I studied the properties of flexible proteins that are not folded prior to binding. These proteins play critical roles in signaling and regulation by interacting with other proteins. I created a computational predictor for protein sites that bind these flexible proteins and explored the relationship with disease-causing mutations.